is Amy. I'm going to be the student nurse that's performing your Head to Toe assessment today. Can you please tell me your name and your age?
Abby Brozoski. I'm 20 years old.
Hi, Abby. Nice to meet you. So just in general, looking at Abby, she seems to be well nourished. She's a little small framed, so she's kind of on the lighter side weight-wise, but that's to be expected just with her build. I don't see any obvious scars or anything like that. I see a tattoo on her arm here. There's a small one on her foot or on her ankle down below, but in general, she seems to be pretty in pretty good health. Affect, her mood, she seems to be appropriate. Posture, a little bit slouched, but that's okay. So moving on to skin, I would say we have a few blemishes here on her shoulders, a few on her face, probably just from acne breakouts, old scars, nothing that's out of the ordinary for her maturity level. There's a mole on her chest. It doesn't seem to have any abnormal borders or anything that should be concerned, we could be concerned with. There's no lesions that are weeping or draining or anything that's open at all. So I'm going to just touch your head if you don't mind. So I'm just assessing your head. Hair is well dispersed. I don't feel any lumps, bumps, anything out of the ordinary in Abby's head. Can you clench your teeth for me? And will you stick out your tongue? Perfect. All right, now I'm going to just touch your face a little bit. I'm just going to tap on the sinuses. So just let me know if there's any pain or tenderness when I do this, okay? Any pain or tenderness here?
No.
How about here?
No.
Here?
No.
And here?
No.
Great. All right, so moving to the eyes. Abby's eyebrows and eyelashes are well dispersed. I don't see any issues there. Sclera are white. There's no redness. Her eyes are symmetrical. I don't see any problems with the skin around her eyes. I'm going to ask you to take off your glasses if you wouldn't mind. I'm going to shine a light in your eyes. Just look straight forward at me, and I'm just going to look in your eyes with my light, okay? And pupils are equal. They react to light, and they also accommodate for each other. So I'm going to test your visual fields now.
Okay.
So my light, if my pen here light, if you could just follow this with your eyes, but do not move your head, okay? Perfect. All right, so the visual field seems to be intact. Now if you could put your glasses back on for me, I'm going to have you cover one of your eyes, whichever one you choose. All right, and with that eye cover, can you read the first line on this card for me, please?
The cow jumped over the moon.
And can you switch eyes? And read the second one.
I think nurses rock.
Perfect. All right, so Abby's vision seems to be intact. She obviously is under a doctor's care because she does wear corrective lenses. Nose is symmetrical. The septum doesn't seem to deviate in any way, shape, or form. If you could just plug one nose for me, or nostril, sorry. Breathe in. And another. Any trouble breathing when you do that? No? All right, so moving to her mouth. Her lips don't appear to be excessively dry, and don't notice any cyanosis or discoloration or anything around her mouth. If you could open your mouth for me, please, and stick out your tongue. Say ah one more time. So her uvula is midline, and tonsils seem to be about a 2+, which is normal. I didn't see any dental caries or anything that was out of the ordinary in her mouth. So moving to the ears. Ears seem to be symmetrical. They're well placed on her head. I don't see any obvious deformities, piercings on both ears, but that's about all. So I'm going to tug and let me know if you have any pain when I do this.
No.
Any pain here?
No.
And how about here?
Nope.
And how about here?
No.
All right, great. So we're going to check out her neck now. First, we're going to test for range of motion and strength. So if you could put your head back for me. And can you touch your chin to your chest? And look side to side. Perfect. Now can you push your cheek against my hand? And again. And shrug your shoulders for me. Great. All right. So I'm just going to touch your and assess, palpate for the lymph nodes here.
Okay.
So here. And I'm not feeling any lumps, bumps, anything out of the ordinary. Trachea seems to be midline and straight. I'm just going to feel your pulse here. And this way. Carotid pulse seems to be strong and equal on both sides. So I'm just going to move to your back now, okay? So in the back, I'm just observing that there's equal chest rise on both sides and no obvious signs of respiratory distress. It appears to be, she has another tattoo on her back here. But other than that, everything looks pretty normal from this viewpoint. I'm just going to put my hands on your lower back. I'm going to ask you to take a deep breath in. All right, chest rise is equal on both sides. Now, I'm going to put my hand on your chest, and when I do that, I'm going to ask you to say the word 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Now you're just going to feel a little bit of tapping as I go around your chest one more time, okay? All right, seems to be within normal limits. So I'm going to listen to your breath sounds now. So anytime you feel my stethoscope on your back, if you could just take a deep breath for me, okay? Okay. All right, breath sounds are clear and equal with good air exchange on both sides. So I'm going to move to the front and I'm going to look at her chest from the front. I don't see any deformities, any lumps, any bumps, anything that I feel like we should be concerned about. So I'm just going to listen to your breath sounds in the front now, okay? Same thing, if you could take a deep breath for me when I put my stethoscope on you. All right, so breath sounds again are clear and equal with good air exchange on both sides. So now I'm going to listen to your heart, okay? I'm going to go intercostal space. I'm not appreciating any murmurs, any abnormal heart sounds. Just normal S1, S2 love dubs. Okay, I'm going to switch to my bell. Okay, heart sounds seem to be within normal limits as well. So, upper extremities. Her arms appear to be equal in length. We're going to do range of motion. If you can put your arms out to the side for me and then move them up to the top of your head. All right, and back down. Perfect. We're going to check the radial pulses here. And they seem to be equal, 2+. Let me see your hand, please. I'm just going to check your capillary refill, which is less than 3 seconds, which is what's to be expected. Perfect. So if you could lay down for me, scooch back a little bit, please. Thank you. And put your hands to your side. So just inspecting the abdomen without touching first, I don't see any obvious deformities. The skin looks to be intact. There's no lumps, bumps, nothing that looks like there could be any kind of process going on. So I'm going to listen to her bowel sounds before I touch or palpate anything. I'm going to start in the right lower quadrant. All right, sounds good. So now I'm just going to do some light tapping on your, actually, what I'm going to do now is I'm going to listen to your aortic pulse here. Make sure there's no brewing. None that I can appreciate right now. All right, now I'm going to do some light tapping on your abdomen, okay? Any pain or tenderness or anything like that?
No.
Now I'm going to just kind of lightly press. You tell me if there's any pain or tenderness when I do this at all. Anything you feel? All right, so we'll move into some deeper palpation here. Any pain, tenderness, anything that bothers you when I do that? No. Great. All right, so the abdomen appears to be within normal limits as well. Moving to the lower extremities, her legs appear to be equal in length. There's nothing out of the ordinary skin-wise on her legs. I'm going to just check for the pulses in your feet. So I'm just going to touch your feet. Torpedo pulses are positive and a +2 and equal, and tibial pulses are the same, 2+ and equal as well. So we're going to do some range of motion with your legs. If you could just let me, I'll just lift your leg, okay? So I'm just going to elevate your leg and bring it this way, and then I'm going to abduct and adduct. Any pain, anything like that when I do any of that? And this one. And no pain or tenderness or anything when I do that?
No.
All right, so you can sit up for me, please. If you would scoot to the edge of the bed. So now we're going to do our neurologic assessment. Okay? So if you can close your eyes for me, I have a cotton ball. And I'm just going to be touching you on different parts of your body with the cotton ball. And you just tell me where you feel me touch you, your skin, okay?
Okay. Left cheek, right upper arm, left upper arm, left lower arm, right lower arm, right thigh, left lower leg, right lower leg, right foot, left foot.
Perfect. So her tactile sensation seems to be intact and within normal limits. Can you put your hands out for me? And I'm going to have you turn your hands pronate, supinate. You do that for me? And can you do it faster, please? Perfect. So that seems to be within normal limits as well. So now we're going to test her reflexes. The brachial reflex. If I could just have your arm for a second, please. Let's set my... Oops, let me get this way. Just relax your arm. Okay, and I can see the movement there. Perfect. That was a good one. All right, so now we're going to move into patellar reflexes. I'm just going to tap your knee, okay? Good job. And this one. Awesome. And then I'm going to test for the Achilles reflex. Sorry, I couldn't think of the word. Great. And this one. All right. I'm just going to draw on the bottom of your foot really quick, okay? Just to check for... And I'm not appreciating any Babinski reflex or anything like that. All right. So now we're going to so if you could take your heel for me and put it to your shin and drag it down for me. Thank you. And the other one. Perfect. So all the reflexes and everything seem to be intact as far as I can tell neurologically. So now I'm going to have you stand up.
Okay.
And we're going to check out your musculoskeletal system. I'm going to have you walk for me. She's going to walk this way. So you just walk in a straight line, please. And then if you can turn around and go heel to toe back. Great. I don't see any obvious gait disturbances. She looks like her gait is within normal limits. And then we're going to test your balance. If you put your arms out to the side for me, and then just close your eyes and lift one leg. And there are no balance disturbances that I can see as well. Range of motion of the spine, if you can lean backwards for me. All right, and then lean forward. And stand back up and then go side to side. And can you twist for me? Great. So everything checks out. Everything looks like we're within normal limits for all the systems. And I thank you for your time and for your help today.
Thank you.
Thank you.